So this is dental anatomy part 2. So let's start with, drawing a tooth. And we're going to kind of draw a molar here. And if you see, there are what looks to be 4, maybe 5 cusps. Fifth cusp can almost be there. So let's look at the different features that are involved. And before I start, what I've done different for this video is I've taken some notes and I've attached it to the video. So if you want, you can go ahead and download it and either follow along with me or use it as your study guide for later. So the first thing we're going to go over is this line right in the center. It's a groove, so it'd be called the central groove. And anytime you have any of these developmental grooves, they're basically formed when the tooth is developing. So the different lobes are actually crashing into each other as it's forming, and it's making these partitions in the tooth. As we look over here, we also have something called fissures, which are depths at the grooves. And fissures are caused by incomplete fusion. So just keep that in mind, that it's incomplete fusion that causes fissures. And anytime you see these points of joining, you're usually going to find pits in these locations. And pits are basically the deepest point in the tooth that's exposed. So this is usually sites that you're going to find caries forming. So the bacteria are going to go inside these pits, and it's really a hard area to brush. So that's typically why sealant is applied, to ensure that the molars are protected so that these pits aren't exposed. Now, each one of these cusps are going to have a triangular ridge. And so your triangular ridge is basically going to kind of look like a triangle, as the name kind of signifies. And we're going to I'm going to kind of exaggerate this and not really be as precise on how the triangular ridge is going to look, but it's basically a triangle. And what's interesting to note is that typically, if we're considering what's called a transverse ridge, you're going to see this whenever there's a buccal and lingual triangular ridge. Typically along here you're going to have what's called a transverse ridge, and the same will be seen right here. So as I said, this right here, we're going to call this the distal buccal, or DB, which is the triangle of the distal buccal. And then the same thing is right here. Now it's the triangle of the distal lingual. Now if you remember from the lecture before, this is the lingual surface, and this is the buccal surface right here. On this side, we're going to have the distal, and this side is going to be the mesial. This area in red that I said is actually going to be called the transverse ridge. The other thing to note is that we have something called the mesial marginal ridge and the distal marginal ridge. And they're typically this area right here. It's basically the site that's going to contact the other tooth. And we're going to get into the different heights and whatnot. So as we progress through different lectures, these are all things that are going to slowly emerge. I think so. The next thing is, what does a fossa look like? So if we have, so what I'm drawing right now is a central incisor. You're gonna have to bear with me, it's not the best drawing, but. And so our central incisor looks like this. And I'm gonna give this a little bit of depth, because right where the lingual fossa is, which is right here, it's almost, when you look at the central incisor, it almost looks like a shovel. And so this area right here has a little bit of a shallowness to it, just creating this depth almost. And this right here is where you'd consider the fossa. And right about here, we're going to have what's called the lingual pit. And so that's another one of those nomenclature things that we got to just learn as quick as we can. And then from there, what we should also learn about is the height of contour. And as it sounds, so if we have our bicuspid here, or premolar, the height of contour is basically the part of the tooth that if we were sitting right here and we look down and we wanted to see at what point is the highest along the buccal or the lingual, that would be called the height of contour. It's always, the acronym for it is HOC. So if we see on this one, the height of contour is probably somewhere around there. And it's about the same for about here. It's a little higher. It's the highest point, or the fattest point, along this ridge. So if you kind of think of it as a roller coaster, as we're going up the hill, the point where we reach the maximum is the height of contour, and then we go down that hill. Same thing on the lingual side. Now for kind of the points, or like the big thing to take away from the height of contour. For the facial surface, most of the time you're going to find it in the cervical 1/3. On the lingual, for the most part, you're going to find it for the anterior teeth on the cervical 1/3 or on the cingulum. So if we go back to this picture right here, actually, let me draw you a canine. That might be easier. So we have a canine right here. So on our canine, we're going to have kind of this bulge that shows up. And the bulge is what's called the cingulum. So if we were to look at the lingual surface of the anterior, this area right here would be the height of contour. And if you think about it, this bulge is going to be the fattest point sticking out. On the posterior teeth, meaning our molars and our premolars, it's going to be more around the middle third of the tooth. So if you kind of refer back to the last video where I talked about the incisal, the middle, or the cervical third, it's basically, incisal, middle, and cervical. So middle third and cervical 1/3. So when I'm talking about the cervical 1/3, I'm talking about this bottom area right here. And now some things to just, these are things to commit to memory. So the longest crown. Now, if we think about it in our mouth, we put our tongue across our teeth and we try to find the tooth that's the longest crown. The mandibular canine is going to win. Now, this is one of those, can't really see it, but whenever you've been shadowing, you've always probably heard of the maxillary canine being called the eye tooth, or the tooth that goes all the way up to the eye. And the reason being is that the maxillary canine has the longest root. So as a tooth for the whole, meaning the crown and the root, the maxillary canine is seen as the longest tooth. The widest tooth, mesial-distally, so mesial-distally, is considered the mandibular first molar. The widest tooth buccolingually, so we're going this way basically, would be the maxillary first molar. And then if you want to think of the most narrow tooth, so now if we go along our teeth again, our mandibular central incisor is the smallest tooth in the mouth. So that's kind of like the easy thing to know. Now, one of the questions that seem to pop up on the boards, and this is something that you should really just know, if we have two teeth and this is kind of like a give me question for the boards. We have 4 total embrasures. Our first embrasure is the incisal embrasure. Our second is the cervical. And then now, if we were to look as though we had those same teeth, and so this is the incisal edge. We have 2 more spots right here. One is at the buccal, and the other is at the lingual. So typically for the board exams, they're going to ask questions that relate to these embrasures. So you might want to make sure you have those in your head. And while we're on the topic, let's think about the different contact areas that are possible. So just know that before we go into the details of where each tooth contacts with another, just keep in mind that whenever you're considering the mesial versus the distal contact, typically the distal contact is more cervical than the mesial. So right here we have the mesial of this tooth and the distal. This contact is going to be slightly lower than this contact. So if this is the central incisors, or tooth number 24 and 25, we're going to have our contact at the incisal third, and then the distal contact is going to be slightly lower. So that's about it for this session right now. If you have any questions, comments, please leave them below. If you like the video, be sure to like it, let me know what you think about it, and if you like the channel, subscribe. And I'll try and pop out some more videos as soon as I can.